evening po sa inyong lahat. Welcome sa ating 36th Kapihang OH. This is a monthly session where we tackle the latest updates in the field of occupational safety and health. We hope that everyone is safe and healthy. Kami po dito sa Philippine College of Occupational Medicine, Quezon City Chapter ay nagagalak na nabigyan niyo kami muli ng inyong oras para makinig at matuto sa discussions natin ngayong gabi. Welcome back to our Kapihang OH. At welcome sa mga first time na naka-join. Marami po tayong participants na ine-expect ngayong gabi. Ako po ang inyong host, Dr. Jason Jan Cabigon, ang Chair ng Finance Committee ng PCOM Quezon City Chapter. Marami na po tayong napag-usapan tungkol sa COVID ng mga nakaraang kapihan, protocols, bakuna, variants, at marami pang iba. Pero dapat updated tayo palagi sa bilis ng mga pangyayari at pagbabago tungkol sa pagharap natin sa pandemya. Kaya maganda po kung buwan-buwan ay nag-a-attend tayo ng Kapihang OH. Ngayong gabi ay tatalakayin natin ang isa sa mainit na topic, balik-trabaho sa gitna ng pandemya. To welcome us all sa ating 36th Kapihang OH, ladies and gentlemen, our PCOM Quezon City Chapter President, Dr. Catherine Artais Carriaga.
Maraming salamat, Dr. Cabigon. Magandang gabi po sa inyong lahat na aming tagapanood at tagapagsubaybay mula sa iba't ibang panig ng Pilipinas at sa labas ng bansa. Sa aming kapamilya sa Philippine College of Occupational Medicine, mga kapuso sa Occupational Safety and Health at kapatid sa propesyon ng kalusugan. Isang mainit na pagtanggap mula po sa amin na bumubuo ng PCOM Quezon City Chapter. Dalawang mapaghamong taon na ang lumipas mula nang tumama ang COVID-19 sa sanlibutan. Kabanatang naitala na sa buhay nating mga Pilipino na mapahanggang ngayon ay patuloy tayong nakikibaka sa bagsik ng pandemyang ito. Sa pagpasok ng taong 2022, siya naman pagtaas na naman ang kaso ng COVID-19. Dulot ito ng pagpasok ng bagong variant of concerns na Omicron. Sa nakalipas na linggo, patuloy ang pagdami ng naitatalang kaso na resulta ng pagpapaigting na naman na restriksyon sa iba't ibang panig ng bansa. Sa kasalukuyan, mahigit na 30,000 kada araw ang tinatamaan ng sakit na ito. Ito na nga ang pinakamataas na bilang na naitala sa Pilipinas. Bagamat ganito ang kalagayan ng ating hinaharap, patuloy pa ding nanatiling nakikipaglaban ng ating manggagawang Pilipino na ipagpatuloy ang trabaho sa gitna ng mapaghamong pandemya. Sa patuloy na resbakuna ng gobyerno at iba-iba pang protokol na patuloy na umiira sa bansa, tuloy ang pag-asa ng nakakarami na matatapos din ang bangungot na ito. Kaya po ngayong gabi sa ating virtual na pagtitipon-tipon, kami ay lubos na nalulugod dahil kasama po natin ang dalawang eksperto sa larangan na ito upang talakayin ang balik-trabaho sa gitna ng pandemya sa ating ika-36 na Kapihang OH. Tara po, tayo ay sabay-sabay na makinig at matuto ngayong gabi. Maraming salamat po at isang ligtas na gabi po muli sa inyong lahat.
Thank you, Dr. Carriaga. To our dearest colleagues and beloved guests from all sectors of the workforce, the chapter is very honored at napaunlakan tayo ng ating mga panauhing pandangal ngayong gabi. Let me introduce both of them first. Our first speaker is the Concurrent Director for Health Promotion Bureau and Disease Prevention and Control Bureau at the Department of Health. Prior to this, she was the Chief of Research Division of the Health Policy Development and Planning Bureau, where her efforts significantly contributed to the passage of key legislation on sugar, sweetened beverage tax, tobacco tax, and universal healthcare. She has also worked in the Philippine Health Insurance Corporation and the Asian Development Bank. Our speaker is a fellow of the Maurice Greenberg World Fellows Program at Yale University, the Equity Initiative, and the Atlantic Institute. She holds an MD from the University of the Philippines and an MPH in Health Policy and Management from the Harvard T.H. Chan School of Public Health as a Fulbright Scholar. Our first speaker is Dr. Beverly Lorraine Ho. Our second speaker for tonight is well known to us, and we are very honored to have her again as a speaker for our tonight's Kapihan. She is the Assistant Secretary for Regional Operations, Labor Standards, and Special Concerns of the Department of Labor and Employment. She is also the Concurrent Director of the Bureau of Working Conditions of the same institution. A bona fide member of PCOM QC. Dear friends, she is Assistant Secretary Maria Teresita S. Cucueco. Bigatin po ang mga speakers natin ngayong gabi. But due to their standing commitments, Q&A will happen at the end of each lecture. Kindly type your questions in the chat box already. We will read the relevant questions after each lecture. So to start the ball rolling, let's all welcome Dr. Beverly Lorraine Ho. Dr. Ho, apologies, but we cannot hear your audio. Wala pa rin pong audio.
Hello? Maliwanag na po ba?
Ay, ayan na po.
Okay. Thank you. So, good evening po ulit sa inyong lahat at maraming salamat po to the Philippine College of Occupational Medicine, Quezon City Chapter for inviting us over to share the latest updates on our guidelines. So, I'll start by sharing my screen na po. No? Alright, nakikita niyo na po ba yung screen? Okay na po. So actually, we really begin with a more positive note, no? Gano'n na po pa tayo kalayo, no? So kung where we are back in 2020. Dati po, no, hindi natin masyadong alam kung sino yung kalaban natin. Walang may immunity from COVID-19. At ikatlo, when the disease progressed, wala po tayong gamot, no? But what is different now in 2022 is that kilala na natin, no, kung sino yung kalaban natin, and we have tools to get to know the virus more. Marami na sa atin mas may immunity from severe COVID and death dahil marami na pong nabakunahan. At huling-huli, meron tayong mga bagong drugs, no, na na-develop na para mag-prevent po yung disease progression. So in short, pwede po talaga nating sabihin, no, na the vaccines have helped us turn COVID-19 into sort of like a flu, no, or regular trangkaso na mas hindi tayo takot, no? But of course, this statement is going to be contextualized kasi para sa mga iba po, na, lalo na yung mga nakakatanda, mas may ibang sakit, syempre, no, mas dapat pa rin mag-alala sa COVID-19. So with this context, I think we want to make this presentation a little bit more practical, no? So dadaanan lang natin yung mga usual na dapat alam natin pero baka minsan nakakalimutan, no? So in this figure, gusto ko lang po, no, makita natin lahat at ma-realize ano yung course of illness ng COVID-19. Una, makikita nyo dito sa yellow, no, na line, mas maunang tumataas yung viral load bago ka actually pumunta sa green, no, or may symptoms. And this also means yung time mo ng infection, itong kulay pink, nauuna po siya sa symptoms. No? So there's really a lag between the time you get exposed before you get symptoms and actually your viral load can peak, no, right before or at the onset of your symptoms. So ibig sabihin lang talaga, you can be infectious even if you're asymptomatic. The third point is that symptoms are a sign that our body is vigorously fighting the virus. No? Kapag nilalagnat tayo, ibig sabihin, yung katawan natin, mental picture, merong naglalaban. No? Naglalaban yung mga white blood cells mo, mga antibodies mo sa katawan mo versus the virus. No? And lastly, yung kailangan malaman, kahit recovered ka na, no, itong bilog, hindi ibig sabihin zero yung viral load mo. Okay? So kaya importante na nagsusuot ng mask properly. Ito lang, I thought I wanted to share with all of you this slide because it just shows you, no, sa Thursday ka pa talaga hindi naging okay yung feeling, pero sa totoo lang, pwedeng Wednesday, Tuesday, contagious ka na, di ba? So kaya ingat talaga tayo when we remove our masks. Next thing that we want to review is swabbing. No? So may iba-ibang lugar kung saan tayo sinaswab. Meron yung sabi nga nila, no, parang utak mo na yung nisa-swab. No? That's the nasopharyngeal area, yung nasa dulo. Napakasakit, di ba? Meron din oropharyngeal swab, pinapadaan sa bibig. At huling-huli, merong nasal swab, no, na medyo mababaw lang kasi nandito lang siya sa harapan. I think what I wanted to be able to emphasize to all of you here is that kapag nasopharyngeal swab, yung swab sa dulo, no, pwede siyang through RT-PCR or yung mga antigen test na kailangan health workers or trained swabbers yung gumagamit. Pero kapag nasal swab, yung nandito lang sa harapan, mas pang layperson yun, no, or yung mga bagong home antigen test kit. It is just important to note na if the test kit is for nasopharyngeal, hindi pwedeng nasal yung swab. No? Otherwise, pwedeng mali yung resulta. Now, ano naman ang mga test? No? Medyo paulit-ulit na to, pero review lang natin. Ang RT-PCR would still be the best test, but you also need to take it on selected days. No? On the days na mapakita natin mamaya, which likely tama yung result. And antigen test, dapat memorize natin to lahat, are best used only when symptomatic, kung may sintomas. Ibig sabihin, kung kayo, wala kayong sintomas, gusto ko lang gumamit, gusto ko lang malaman, no? Whatever results you might have, take it with a grain of salt, no? Because you can never be sure, especially if you're asymptomatic. But if you're symptomatic, ubo-ubo ng konti, then the likelihood that tama yung antigen test ay mas mataas. Okay? Now, for isolation and quarantine, we just want everyone to remember ano ba ang quarantine, no? Basta wala ka pang sintomas, na close contact ka, quarantine yan. The moment meron ka ng sintomas, isolation na yung tawag doon. Okay? And then lastly, kapag nako-confuse pa kayo, sino ba ang fully vaccinated, no? Someone who's fully vaccinated means it's 2 weeks after your first dose of Janssen or 1 dose of Janssen and 2 doses of 2-dose regimen, no? Second dose of your 2-dose regimen. Okay, so ito na, no? So dumating na si Omicron sa buhay natin this November, and then sa Pilipinas na feel natin siya after the holidays, diba? Meron lang tayong mga kailangan malaman about Omicron. 3 things lang, no? First is that mabilis siya, no? Mabilis siya because it replicates faster. Mabilis siyang magparami. Kung na-infect ka niya, mabilis siyang magparami sa loob ng katawan mo. And the symptoms, because mas mabilis siyang dumami, mas maaga yung sintomas mo. No? Kasi mas maagang napupuno, kumbaga ng bad virus yung katawan mo, so mas maaga nagfa-fight back yung katawan mo. Ito yung bad news, di ba? Pero ano yung good news na gusto nating malaman mamaya? So, doon muna tayo sa bad news, no? So, typically, nung Delta variant na COVID, nasa day 5 to day 7 tayo nagpapatest, no? Pero actually, sa Omicron, mas maaga kasi your symptoms are also earlier. Okay? So, this is related to it being fast. So, but because a lot of us are vaccinated, particularly tayo dito sa NCR, no? Maraming na nabakunahan, merong good news about Omicron. The first piece of good news is that Omicron trends are sensitive to vaccination. Ibig sabihin, kahit tumataas yung kaso, hindi ganun, no, yung pagtaas ng severe and critical cases, no, as opposed to yung mga nangyari dati. No? Pagtaas ng confirmed cases, kasabay ng pagtaas ng severe and critical cases. Ngayon, hindi ganun. No? So that is what we call decoupling. And good yun dahil ibig sabihin dahil maraming nabakunahan, mas maraming mild and asymptomatic cases. No? Tingnan niyo po, no, itong delta peak. Mas malaki po yung porsyento na pula, no? Mas maraming severe and critical cases as opposed to ngayon, no, na mas malaki yung light blue and light green, di ba, kaysa sa pula. No? So, kaya natin ito makita dito sa NCR kasi naman ang taas ng vaccination rate natin. So with that, we know there's science to proven protective effects of vaccine, to a faster transmission by Omicron, to milder disease from Omicron. But we also need to balance it, no, that it will threaten our health system and the economy due to prolonged quarantine and isolation, no, yung dating guidelines natin. So we looked at other countries in their updated guidelines, and what we can say now is that we have a guideline now, an updated guideline that supports, no, both public health goals, but also availability of basic health and social services. So ano to, no? So this slide summarizes the changes in the 5 main pillars, no, of our COVID-19 response. So prevent, detect, isolate, quarantine, and treat. No? So I'll go one by one. So for prevent, we're very clear. We don't want large-scale lockdown. No? It's more granular lockdown. And then we still follow our mask, hugas, iwas, airflow, bakuna tagline. Diba? Yan yung gusto natin sabihin. So for mask, there are 2 main items that we want people to remember. So fit and filtration. No? Often people look at, ay, ano yung type of mask na meron ako? Kailangan N95, pero mahal, etc. No? What we're saying is, yes, masks are not created equal. Merong 3-star dyan, N95, KN95. Pero kapag double mask, that's what we recommend for everyone else, no? Okay na din siya. But more importantly, for filtration, it will be very important na kahit maganda yung mask mo, kung hindi maayos yung fit, edi wala rin, no? Parang wala rin siyang sense, no? So 2 things for mask, fit and filtration. Now, for ventilation, ito minsan, no, akala ng mga tao, ay, okay na, basta nakamask ko, nandun naman pala siya sa lugar na sobrang sikip, no? Or closed, indoor, napakaraming tao. No, that's not what we want. We are emphasizing the need for good ventilation by doing all of these initiatives, no? Opening a window, making sure, no, yung mababa yung flow ng bagong hangin sa labas, itapat mo yung electric fan doon, di ba? Tapos meron pa rin tayo dito na mas more specific, no, na mga advice. We can share the slides to the organizers so this can be distributed to you guys. Now, for detection, ano yung magbabago? No? So detection is typically knowing from our symptoms and what to do for testing. Now, for symptoms of COVID-19 versus allergies, no? Ito maraming tao nagtataka kung ano ba yung meron ako? COVID-19 or allergy? No? So this was one of the best infographics I saw also online. No? So kapag medyo may kate siya, syempre dapat may history ka ng allergies. No? Makati yung lalamunan mo, makati yung mata mo, nagsisneeze ka, that's more likely, no, allergy. But if you're more on the left-hand side, nagkaka-diarrhea, nagkakalagnat, no, nawawalan ng panlasa, pang-amoy, that's more likely COVID, no? Pero you can see that in the middle, medyo pareho sila ng ibang symptoms. Okay? Now, for our updated testing recommendations, we are showing you here this table, no? Basically, what we're saying is that for healthcare workers, tuloy lang, no, kung ano man ang testing regime natin. But we want to be able to prioritize testing, particularly RT-PCR testing, for senior citizens or persons with comorbidities. So, ibig sabihin, gusto natin that testing can actually be valuable kung magbibigay tayo ng gamot sa kanila. Later on, dadaanan natin kung ano yung mga gamot na yon. Pero, what we're saying here, pag matanda yan or may comorbidities, go tayo sa testing. No? Pero, if hindi ka matanda, walang comorbidities, na walang sintomas, at na-expose ka to a positive case, actually, whether antigen test ka or mag-RT-PCR, wala ka naman kailangan gawin next kung hindi mag-quarantine, diba? So that's really the advice, and it doesn't add any value, so you just need to quarantine. If you're not part of A1, A2, A3, meaning hindi ka senior, walang comorbid, pero may konti kang symptom, ang tanong din, what will the test give you? Ang kailangan mo lang rin talaga gawin is to isolate and do home care and teleconsult. So this one, testing is optional, but maybe encouraged, pero hindi must test. Okay? So with this, I also want to again remind everyone that there are antigen test kits that are designed for health workers. There are antigen test kits designed for laypersons. So dahil dito, make sure lang na kapag design siya for health workers, wag yun yung gagamitin natin kung layperson tayo at magkakamali tayo ng lugar na isuswap. Now, important also for us, especially when we advise, lalo sa mga HR counterparts, may mga good brands ng antigen test kits. Hindi ako nag-advertise dito, pero yung mga nakita nyo sa FDA na website, merong mga good brands. You don't just look at the brands, you look at what the box is saying. The box actually really says na, is it meant for nasopharyngeal swab, yung malalim? Then pag ganon, talagang health worker yung gagawa nun. Kapag nakalagay na nasal swab siya, likely, yun yung pang layperson pwedeng gamitin. Alright? Then we go to the third strategy, which is isolate and quarantine. For this, we're shortening isolation and quarantine period for vaccinated and boosted only. And we want to emphasize, hindi kailangan hintayin yung test result. Pwede ka nang mag-isolate or mag-quarantine. Go na. Okay. So this is for laypersons, quarantine period, 5 days from exposure, at pwede ka nang sumama sa kapamilya mo after 5 days, provided di ka nagkaroon ng symptoms. Pero kapag hindi ka pa bakunado or partially, hindi natin yan binabago. 14 days pa rin yan. So, may mga nagtatanong, so kung fully vaccinated ako after 5 days, pwede na ako lumabas sa kwarto ko. Pwede na ba akong manood ng TV with my family? Of course. Pwede na ba akong kumain with my family? Ito, mas careful tayo. Hindi pa, kasi pag kumain ka, likely magtatanggal ka ng mask, And yung preventive lang natin is you don't expose other people yet as much. Kaya we say here, 5 days from exposure, but continued strict mask wearing at home for the next 14 days. Okay? Next, yung isolation period, wag nyo nang tingnan tong moderate, severe, at immunocompromised. Kasi malamang may doktor yung mga yan, at they can say na 21 days or even less, basta na-clear na sila ng physician nila. But look at the first two columns. So probable case, mild COVID, at positive asymptomatic case. From 10 days, ginawa na nating 7 days. Okay? Pero ano yung catch dyan? 7 days as long as the last 24 hours walang fever. So, baka mas madali itong diagram. So, for quarantine, quarantine ka mag-isa for 5 days. After that, strict mask wearing and symptom monitoring until 14th day. Pero kapag isolation, meaning meron ka ng konting symptoms, 7 days isolate, pero dapat sa last 24 hours mo, meaning sa entire day 7, hindi ka naglagnat or walang daya, hindi ka gumamit ng paracetamol or any other antipyretic. Paano kung sa day 7 mo, nilagnat ka pa rin? Well, extended ka, day 8. Day 8, nilagnat ka ulit, day 9. Day 9, wala ka ng lagnat, day 10 ka pa makakalaya. Okay, so ganun yun. So the last 24 hours mo of isolation has to be fever-free. Ngayon, tanong mo, okay, day 7, okay na ako, wala na akong fever, pero may konti pa akong ubo-ubo. Okay lang yun, As long as improved respiratory symptoms, wala ka ng fever the last 24 hours, pwede nang lumabas. Now, we also want to emphasize that isolation and quarantine can be stressful to the mental health, and we have this app, free app for download that you can actually use while you're on isolation and quarantine. Next, for treatment, telemedicine is the recommended because most of the cases are mild, no? And we have access to drugs. So here I just put the numbers that you might need to know or print, no? Para makatawag kayo, the much needed medicines and kit that you need, and also a template, no, of the monitoring sheet. I think more importantly, you will need a copy of these medicines because these are what people can keep, no, in their home cabinet for the different types of COVID symptoms. So I won't go through it one by one, but you can get a copy of this, and it's also in DOH issuances. These are the outpatient na di kailangan ng prescription. And then the last two slides that I have are really on the mild to moderate non-hospitalized COVID drugs. No? So these are the ones with special permits, CSP and EUA. And remember, no, ito yung sinasabi natin na kung ang mga tao ay parte nitong mga groups na to, mga maraming sakit, you need to know na nagka-COVID sila. No? You need to know at certain na nag-RT-PCR sila kasi pag pinainom mo sila nitong mga gamot na to, it will be very, very critical na sigurado kang COVID, no? Because these medicines are not risk-free, no? So they are with EUA, meaning, no, may benefit and risk. No? So to make sure na yung benefit ay sulit, no, kumpara dun sa risk, then you need to make sure talagang may COVID sila, no? So they're not for everyone. For example, if it's molnupiravir, I'm a 30-year-old professional, healthy, wala akong ibang sakit. Kung COVID ako positive, hindi rin ako dapat mag-molnupiravir. No? This is what we need to remember. So meron kaming mga nakitang LGU na nakasama to sa kit. Medyo hindi yun recommended, no? Kasi hindi to dapat basta-basta lang iniinom. Same with drugs for moderate to severe COVID. No? So they're all here. All we wanted to show you here is grabe, may gamot na. No? Hindi na tayo pareho noong 2020 na takot tayo. So dahil may gamot na, meron lang din tayong mga guidelines na kailangan sundan kasi not without risk naman itong mga gamot na. Okay? So my last point lang po is to remind everyone na the COVID has long-term effects, no? Particularly for some groups of patients. And these long-term effects, the symptoms are here all on screen. So hindi po basta-basta lang na okay lang magka-COVID, no? Kasi may mga ibang medyo binalas lang ng mga tao na matagal, 4 weeks, 5 weeks, 8 weeks, or even a year, may mga sintomas pa sila ng COVID. So let's just take care of ourselves, follow our mask, hugas, iwas, airflow, and bakuna always, and make sure you're boosted. So that will be all. Thank you very much for your kind attention.
Thank you very much, Dr. Ho. Indeed, very practical talaga yung inyong approach. No? I really appreciate your slides. Madali talaga intindihin. So I will be your moderator for tonight. And at this juncture, let's officially start our open forum. Actually, konting questions lang po, Dr. Ho, no? Ang nasa ating participants. So if it's okay, pwede na po ba tayo mag-start? Thank you. Okay, so yung first question natin will be about the shortened protocols po, quarantine protocols that you presented ay inline sa IATF na guidelines po yan, no? Okay.
Yes po, it's the same one.
Opo, thank you po. Kasi there are concerns na the COVID response nowadays is very decentralized already. So may mga birth, for example, that will use other timing ng ating quarantine periods. This will lead sa certain problems, especially sa HR ng bawat mga companies. No? Of course, most of the companies will require birth clearance, completion of quarantine certificate. Kaya lang, yung ibang birth hindi in line doon sa just the shortened quarantine period. Meron po bang say ang DOH with regards to this?
Well, I think what we're providing really is guidance. And typically, no, yung mga experience natin sa ganito, basta you are familiar with the specific guideline number, which I think I should give to you. in a short while. Dalawang key policies to that covers all of these. If you're really able to give it to the birds and get them to read it, usually no, naka-clarify naman sa kanila. Pero let's just also remember na typically yung orientation kasi, di ba, parang PowerPoint, ganyan, no? So, yun na lang din yung naaalala din ng mga birds. And so, there are just times that we have to remind them that this is actually what's written in the policy.
Okay, thank you for that. Another question naman from our participants. So one question is, even if with respiratory symptoms, as long as improved and isolation requirement was finished and no fever within 24 hours, they can return to work already?
Yes, no? Pero syempre, kaya strict mask, ano pa rin tayo, and making sure na hindi na siya mag-hangout na nakatanggal yung mask, no? As compared to other people, diba? I mean, we really discourage it naman at work, kumain together, no? So, but mas strict lang tayo doon. But yes, you're right. As long as fever-free for the last 24 hours and improved symptoms, kahit may remnant pa ng konting ubo, yes, pwede na po.
Okay, thank you. Thank you for that clarification. Ito medyo we'll be asking for your opinion, Doc. Ano daw ang pwede nating i-advise sa mga manggagawa na may simptomas pero ayaw magpa-test?
So sa atin, no, based dun sa pinakita ko po sa inyo, sa atin, as long as we know may symptoms, the immediate thing to do is to isolate already. No? At kasi nakita nyo kung mas maiksi na yung isolation period ngayon, di ba? As long as matapos na niya yung 7 days, okay na. Alam din naman natin kasi, no, practically speaking on the ground, may delays, di ba? So kunwari, na nagkaroon ka na ng symptoms, magpa-schedule ka pa, day 2 ka na nun, no? Tapos makuha mo yung resulta, day 5 or day 6 na, di ba? So you already know, tapusin mo na yung isolation period, that's it, no? So parang you presume. And it's similar to actually many of the things that we see, di ba? As physicians, for example, na sa trangkaso, di naman tayo nagpapatest, di ba? Sa dengue, hindi lahat pinapatest natin, no? So parang syndromic, kumbaga, yung tingin natin. As long as magawa na natin yung kinakailangan intervention, ganun na. So siguro, sir, kailangan ko rin sabihin, no, na our guidelines are tentative, di ba? Ibig sabihin, these were adopted dahil ang konteksto ngayon is yung umiikot na predominant variant ay COVID, ay Omicron, no? Na mas mabilis, ganyan, no? So in case, at God forbid, no, umabot tayo ulit sa point na ibang variant, hindi ganito kabilis yung ikot, mas hindi mild, rest assured, no, babalik yung guidelines sa mas mahabang period. So nag-a-adapt lang din talaga tayo sa kung ano yung kalaban natin ngayon. Over.
Okay, thank you for that. For our participants, don't worry, I think you have plenty of questions. We have a second speaker pa, but due to interest of time, we will have to ask the last question kay Dr. Ho. Siguro ito medyo controversial lang. I don't know if you're familiar that recently our president mentioned that booster shots are harmful. What's your personal take daw po on this?
I think, sir, we and the cabinet secretary has already issued a clarification, no? So parang that video clip was actually taken back in September na hindi pa po tayo nagre-recommenda ng booster, no? At kung maalala niyo, yun yung mga panahon na merong mga reports ng mga tao na mga nakadalawang rounds na ng bakuna, di ba? So that was really the context, no, na hindi pa nababakunahan yung karamihan ng mga Pilipino, so we still don't do it at wala pa tayong booster policy. But they clarified already, Malacanang clarified that the president also in December actually already made a talk, no? Nagsabi na siya na magpa-booster yung mga tao. So I think we just need to propagate that more, yung clarification, pero hindi po yun sinabi in the context na huwag tayo magpa-booster.
Okay, thank you very much. Yun, malinaw po, no? Ang sagot po natin dyan. So, Doc, marami pong may mga questions pa. If ever, paano po natin kayo makukontak? And may mga nagtatanong if they can have the presentation as well. Possible po ba yun?
Yes, yes. I'll just share the presentation with the organizers, with si ma'am, who's contacting me. And then please feel free to share it naman po.
Oh, ASIC test. I think ASIC test will have.
No, I just wanted to greet Dr. Bev.
Hello, ma'am.
Dr. Bev, ang daming tanong dito. Sagutin mo yan. Hindi yan. Ako sasagot yan. Basta, with the blessing of Dr. Bev, I'm going to give my personal opinion. Hi,
Opo.
Dr. Bev, we've been missing you.
Thank
Nice
you
to
po,
see you.
Asik. We'll see you in a while po. So, maraming salamat po ulit, Dr. Ho. So, may we invite you to stay and keep your camera on for the presentation of the certificate. May I request Dr. Taylor, our PCOM QCC Secretary, to present the certificate?
Thank you, Dr. Tabigon. Dr. Raho, thank you so much for being our first speaker for this this January for our very first Kapihang OH for this year. So this certificate reads, the Philippine College of Occupational Medicine, Quezon City chapter presents this certificate of appreciation to Dr. Beverly Lorraine, Director for Disease Prevention and Control Bureau, Department of Health, for serving as our resource speaker for the chapters 36th Kapihang OH.
You would like to report? Report.
Thank you. Thank you po, Asik. Actually, may nagtatanong din po. So, wala rin po bang para magiging violation yung company if ever na hindi po nag-report sa birth from the company side?
May notification talaga eh. So, but as long as the company knows and they already have the mechanism, because that program should also be there, they should be reporting as well. Now, let's not talk of penalties, but there is a responsibility, especially once the companies do know, they should be reporting all of this to the birth. Pero iba-iba nga yung birth kung saan-saan din nakatira. Di ba? So they will have to report to the different, and if they all stay in like a dorm in one area, that's fine, it's only one birth. But if they go home to different areas, then they have to report to the different areas kasi iba naman barangay ang magmo-monitor sa kanila.
Tama.
Or they can also work together. The company can say, nag-report ka na ba? Kasi kung hindi ka pa nag-report, sige kami na mag-report. Pero kung nag-report ka na, thank you. You know, at this point, the teamwork is going, and that all responsibilities from the employees to HR to the employers, it should now be an approach where we are coordinating all our actions to really have the best measure in place.
Okay, thank you. Thank you po. So at the end of the day, talagang tulungan lang po talaga tayo lahat.
Oo.
Okay.
Diba? And everything. And lalo na din, you know, if companies would have, you know, the COVID care kit. I know companies have been doing that. Those are also very good initiatives by companies.
Thank you po. Another interesting question, ito po Asik, no? Dahil may mga work from home arrangements na po tayo, required pa rin po ba ang annual medical examination sa ating mga empleyado?
Ang nagwo-work from home ba, hindi na magkakasakit? Alam mo, ganito yan. Bakit diba may annual medical? Diba? It is really a monitoring of disease, work-related or not. As you get older, you also have more diseases, but it's really monitoring from the usual hypertension or whatever other diseases that can happen, whether they're work-related or not, mga iron deficiency anemia, yung mga, the chest x-ray, kaya may TB ka hindi. But what my point here is, yes, they're working from home. We never said that annual medical examination or the annual physical examination should only be done for workers on site. Remember, even before COVID, you had field workers. And because they were field workers, they would be go elsewhere. What did we just say that only those who were in the traditional workplaces should have it was for all workers because of the value of an annual medical examination to monitor the health of the employee through the years. And there are difficulties now, but there's telemedicine. And then for the laboratories naman, you can now have them scheduled. The x-rays can be a little bit challenging, but they can also be scheduled as well. If the DOLE wants to ask, then at least you've done like initiatives on telemedicine, you've asked them to fill up survey questionnaires as the beginning part of your annual medical. The DOLE understands naman that there are certain difficulties in having that annual physical examination done because of the situation now. But again, we should not discount the fact that there are ways that you can also be doing this.
Thank you po, Asek. Sobrang linaw po ng inyong message. Now, the last cluster po ng questions will be about social insurance. Pero siguro po for the listeners, yun na po ang magiging next topic po natin sa Kapihang OH, the statutory benefits connected to COVID-19. So better mag-participate po tayo ulit sa susunod nating Kapihang OH. So, Asek, maybe we can ask for last few take-home message from you.
Okay. Number one, I hope all your employees are vaccinated. I hope you were able to bring out the importance of vaccination for the employees. We have heard still of many companies na napakataas pa rin ang vaccine hesitancy. I think we should be working together so that you can deal with the fear, the anxiety. Number one, they do have a fear, they do have an anxiety. But how to best approach this? We do not like, government does not want to be coercive. We never wanted that to happen. But if we are putting these programs or if this issuances in place, it also asks us as physicians to see how best we can improve behavior and mindset. What will make them look at vaccination as an important protective tool? If they listen to their neighbors, maybe you can also bring in experts to convince. Like I was telling, and those, if you want me to, kasi in the beginning when vaccines came in, I did have the fear. But because, my fear of having COVID was higher, was worse, and then I had the vaccines immediately. But we all had that, especially because we didn't know what we were facing with vaccines. Then we knew, wala naman palang dapat ikatakot. Diba? Ang dami kasi munang lumabas na, ay, may namatay, kung ano na naman nangyari. But work towards the fear, the anxiety, and bring them to a proper or a mindset that is scientific, that is evidence-based on the value. Next, we are physicians. Let us exercise our responsibility as physicians. We always like to look at what the issuances are, but remember, we also, it's aligning ourselves to this issuance, like where you were saying, kung wala yung be hurt, doktor pa rin naman tayo. We can ask, we can tell HR, kung hindi naman sila kasi nag-allow na ang antigen test then allow medical certificates also, because you are going to exercise your role as a physician very well. Then I was saying here, sinong dapat mag-report? If you have a safety and health committee, alam nyo na sana dapat yan sa kampanya, na isulat na kung sino. Pero, if the person can also report, that would be good. Reporting 10 times is fine, because, eventually, but then, at least, there's someone to monitor. And if you want that be hurt certificate, you're going to get it because you have reported. But if not, and there are also, of course, those we have to deal with persons who do not like but will do the proper thing. Then exercise your best judgment already. Doktor ka pa rin. And sa mga Safety and Health Committee, I was seeing questions here on ventilation. Paano kung aircon? I hope you're looking at our Department Order 224 on ventilation in workplaces because it covers closed workplaces, air-conditioned workplaces. If you cannot open your windows, there are ways and means to have an air change. You can work with the HEPA filters. You have the they should be present in the HVAC system, the heating, ventilation, air conditioning system. As the building administrator, continue to have good exhaust, continue to bring in fresh air as needed, kasi these are the air exchanges that can provide the needed good indoor or fresh air to change contaminated air, replace it to have good ventilation even in closed workspaces. So look at all the guidelines, and if there are questions pa, Dr. Bev from the DOH, from the DOLE, even the DTI, we are all one here and together with you in the fight against COVID. Malapit na, kakayanin natin to. Diba?
We pray with you also, ASEC. So muli, maraming salamat po, ASEC Cucueco, especially for those last pieces of advice. No? Talagang marami pong na-share sa ating mga participants. At salamat din po sa mga nag-participate ngayong gabi. I know marami pa po kayo mga questions, but we have to manage our time. No? And again, for those questions related to benefits and insurance, we will be discussing this sa susunod po nating kapihan. A very fruitful evening indeed. So ASEC, may we invite you to stay and keep your camera open for the presentation of the certificate. May I request Dr. Angela Taylor to present the certificate of appreciation.
Thank you, Dr. Cabigon. Dr. Cucueco, thank you so much again for being our speaker for this 36th Kapihang OH. So the PCOM Quezon City chapter would like to present this certificate of appreciation to Maria Teresita Cucueco, MD, Assistant Secretary of the Department of Labor and Employment, for serving our resource speakers for the chapters 36th Kapihang OH entitled Balik-Trabaho sa Gitna ng Pandemya, given on this 26th day of January 2022, Quezon City, Metro Manila, Philippines. Signed yours truly, Dr. Jose Angelo Taylor, Chapter Secretary, and signed Dr. Catherine S. Cariaga, Chapter President. Thank you so much, Dr. Cucueco.
Thank you, Dan.
Cabigon, thank you po, Dr. Cabigon. You have the floor.
Thank you, Dr. Taylor. Now, we will be having our traditional online photo opportunity. ASEC, can we have the opportunity po to have a photo with you?
Sige na nga.
Salamat po. Dear participants, kindly turn on your videos.
At I haven't greeted the President, Dr. Catherine. Good evening din po.
Good evening, ASEC. Maraming salamat po.
Saka si Dr. Jing, ang kulit.
Thank you, ASEC. Katatapos mo lang natin ng kagabi na meeting.
Oo nga.
Ayan. Salamat, Dr. Taylor. So again, ito po ang ating virtual kapihan team ng PCOM QCC. Also, this webinar will not be possible without our PCOM QCC CME team na pinangungunahan naman ni Dr. Maria Cecilia Diana. Maraming salamat po, Dr. Diana as well. To formally end tonight's educational activity, ladies and gentlemen, our Chapter Vice President, Dr. Jeremias M. Florante.
Thank you very much, Dr. Cabigon. After the holidays, workers will be coming back to work from their respective places. More often than not, these places are outside their residences. Since it is holidays, most likely workers have been into gatherings. This led us to questions on how to deal with these workers, especially that we are still in the pandemic. Tonight's lectures from Director Beverly Lorraine of the Disease Prevention and Control Bureau of the Department of Health and Assistant Secretary Maria Teresita S. Cucueco of the Department of Labor and Employment provided us inputs on how to deal with the situation. As such, our profound thanks to our resource persons for the tips, advice, and suggestions. Thank you also to our partners, our fellow occupational health personnel, safety officers, human resource personnel, accredited occupational safety and health practitioners and consultants, and other advocates of occupational safety and health. Hope you have learned a lot from tonight's discussion. Our deepest gratitude also to the national officers and board of directors of the college, the past national presidents, and to its general membership for your presence. To the men and women behind this Kapihang OH, thank you. Tonight is also the premiere night of the 35th Kapihang OH in our official YouTube channel. The 35th Kapihang talked on COVID-19 vaccination. So I am inviting everyone to subscribe to our YouTube channel and hit its notification button for you to be updated our uploaded videos. I would like to invite you to like our other social media accounts in Facebook, Twitter, and Instagram. For comments and suggestions for our future Kapihang topics, please do not hesitate to send us an email at pcomquezonCityChapter@gmail.com. Again, thank you very much. Always do not forget that in Quezon City Chapter of PCOM, we value your safety and health. #PCOM QCC cares. Good night, everyone, and ingat.
Thank you, Dr. Florante. Marami po pala nagtatanong if they can have the copy of the presentations tonight. And yes, we will be providing you copies. Isasama po namin sa inyong e-certificate. Again, yung inyong kopya ng ating lectures at e-certificates will be sent sa inyong mga emails. Muli, maraming salamat sa lahat ng nagdalo sa ating 36 Kapihang OH. Pero do you know na since 2020, wala pa tayong buwan na walang Kapihang OH? Yes, ang Kapihang OH ay napaka-consistent na activity ng PCOM QCC. Pero honestly, hindi po madali ang mag-organize ang Kapihang buwan-buwan. Kaya kung nakatulong po sa inyo ang aming mga sessions at gusto niya pa po ng iba pang makabuluhang mga sessions, ang hinihiling lang po namin ay for everyone to subscribe sa aming official YouTube channel, like our Facebook page, follow our Twitter account and Instagram account. All of our past sessions are uploaded in our YouTube channel. And syempre, don't forget to like, share, subscribe, and hit the notification button. Libre lang po yun. Check out our channels. Search lang po, PCOM QC in all those social media platforms. And your support will move our chapter to even more projects that will benefit everyone. Maraming salamat sa inyong pagdalo sa susunod na 37th Kapihang OH. Ako po, si Dr. Jason Jan Cabigon, na parating nagpapaalala na sa Quezon City Chapter ang inyong kaligtasan at kalusugan ay mahalaga. #PCOM QCC cares. Good night, everyone.